Magandang hapon po sa inyo lahat. Welcome to Veronica's segment of the show. Today, I have a very exciting, surprisingly very young physician as my guest today. And I have to read this introduction because he has such an impressive biodata and experience in this young age. Let me introduce first to you, Dr. Dan Garganera. Welcome to our show, Dr. Garganera. And he's a Filipino-American, very popular Filipino-American physician in the Will County area. Okay, let me read a little bit about his bio. Dr. Garganera is a Phil-Am doctor, an infectious disease specialist. Isn't that impressive enough? Of the Southwest Infectious Diseases Associates, where he is the infection control chairman. Is that right? Infectious.
That's right.
Infection control chairman. He is currently the medical director of the Will County TB clinic. TB stands for tuberculosis, right? Is that TB? Tuberculosis? Dr. Garganera?
That's right. Yes, it is.
Okay. And the medical advisor for the Will County Health Department. Okay, that's very impressive. What I've read is really actually very impressive. Here's some more. Recently, Dr. Garganera was given a recognition as the outstanding Filipino-American physician of the Midwest by the FAHM. FAHM stands for Filipino-American History Month, Dr. Garganera, right? History Month.
That is right. Yes.
And was honored a few weeks ago by Governor Pritzker for his outstanding work, dedication, and service to the community with regards to COVID-19 pandemic. That's a very, very interesting topic that we have to talk about. In addition, he graduated as magna cum laude from a medical university in the Philippines, garnering major awards and recognition in his hands. Magna cum laude, believe it or not, in medical school. Oh my God, what else? Am I missing something else?
Well, among many other things, I was able to do a lot of other lectures. I've been a speaker for different drug companies. I've been in the school paper before. I'm still doing many other things like writing. And back in the Philippines, I was chosen as one of the 10 most outstanding students of the Philippines just before I came to the United States. So TOSP back then. So those are some of my achievements back in the day. About infectious diseases, about COVID-19, and working in 2 different hospitals, 2 different clinics, as well as the health department. So a lot of juggling around different kinds of responsibility.
Wow. Oh, wow. And how old are you at this young age? I'm sorry, we have to tell our viewing audience how old you are, how young you are.
52 years old now, so time flies when you're having fun.
53 years old, right? 53.
52.
52.
52, yeah.
Right. My God. All right. Congratulations. And we salute you to all with all your accomplishments and awards. And we are here in the Filipino-American community of Chicago. We are really very proud of you, hearing about your accomplishments although we don't see much of your face in our gatherings, maybe one of these days we can introduce you to some of these groups. Are you a member of the Philippine Medical Association?
Currently, I'm not a member of the PMC right now. I wish I would have more time, but I have to juggle multiple things. So it's been so busy. It's so difficult to join organizations, and with a busy schedule, I don't think I'll be able to do much in terms of social gatherings, unfortunately.
Well, of course, we understand that. Oh, all right. Here's my question now. As a respiratory specialist,
Mhm.
you must have done and must have been involved in this problem of ours, health problems that we are experiencing recently, which is the COVID-19. What have you, or what can you tell our viewing audience about what a respiratory specialist does? I know it's number one physician, or when you have COVID, you have to go to a respiratory or pulmonologist because what it affects your lungs first, right, doctor?
Yeah, so COVID-19 is an infection that affects the whole body, and the majority of cases affect the lungs. So for patients who are infected with COVID-19, the most important doctors are us, the infectious disease specialists. And when patients starts getting pulmonary symptoms or respiratory distress, then they need to see a pulmonologist or critical care specialist. Most of the time when they get admitted to the hospital, the first thing they consult is us, infectious disease. But when patient starts getting to be more short of breath, needing more oxygen, then we call in the pulmonologists to help us manage the case. So it could also, COVID-19 could also affect other organs. It could cause strokes, for example. It could cause heart attacks and blood clots in the lungs. It could cause blood clots in the legs. It could also cause gastrointestinal problems like diarrhea and vomiting, and liver problems, and could cause kidney failure. So COVID-19 could affect the whole body. That's why it's so bad. And the majority of patients actually suffer pulmonary infection or pulmonary distress. That's why the pulmonologists are involved. So the top two busiest specialties nowadays are the pulmonologists and us, infectious disease.
I see. Is it mainly really the lungs instead of the heart that it that gets affected by this COVID?
Yes, when you inhale the virus, it infects the upper respiratory tract, then it goes to the lungs, and then later on it could affect the heart, it could affect the brain, it could affect other organs, but
Or
that's the
other
portal.
organs?
Yes, and that's why patients will get respiratory problems right away.
When you say all other organs, just like what are all other organs besides the heart, the lungs and the heart, and what else that will get affected afterwards?
So because COVID-19 causes clotting, it could cause blood clots in the lungs. It could cause blood clots in the legs. It could also cause heart problems like heart attacks. It could affect the brain and it could cause a stroke. It could also affect secondarily your kidneys and cause kidney failure. In some patients, it affects the bowels too. We have a lot of patients coming in with diarrhea and vomiting from COVID.
Oh
It
my
could also
God.
affect of smell and taste. You could lose your sense of smell, your sense of taste. And liver problems are common too in COVID patients.
Oh my goodness. I didn't know that. First time I've heard about this. Well, with these variants that we're having, I mean, we will be having supposedly, uh, which is the way it was predicted, uh, it is going to be worse than what we have right now. Is that so?
Well, it's a virus. It's a coronavirus, and viruses mutate. All viruses mutate, and coronavirus is able to mutate and develop variants. Currently, there's so many variants already, like 45 different variants. The common thing we hear is the Delta variant. There's the Beta variant. There's the P1. But the thing we see in the news a lot now is the Delta variant. These viruses the variants are more contagious, but they don't necessarily cause worse disease. And for patients who already had infection before, they're less likely to get infected by these new variants because they have immunity. And vaccination also helps in some cases. But the Delta variant and these other variants are expected to appear just like any other variants and any other viruses, such as the flu. For example, the flu virus. Every year, patients we're recommended to get a flu shot every year because the virus mutates every year, for example. But if you have immunity to it already, for example, if you had previous infection, then the variants are less likely to infect you. If you have immunity against it, it's less likely to cause severe disease as well.
Oh, immunity. Isn't it that, yeah, once you have COVID, you already have the antibodies in your body. And so is it still necessary to have a vaccination?
Well, for those with natural infection, you have actually a better immunity than the ones who just get the vaccination. Those who get the vaccination will develop antibodies. You could develop a little bit of T-cell immunity as well. I don't want to go technical too much, but if you had actually a natural infection, you have beta cell immunity, you have T-cell immunity, and you could develop memory cells so that if you get exposed to the virus again, you will immediately develop more antibodies again. So the recommendation now is for the boosters, for example, is to allow the body to produce more antibodies. But for those who had previous infection, the benefit is not really that clear. But for those who had previous infections, it is expected that you will be more immune or less likely to get severe disease if you get it.
Okay, how about, it seems that many people, not majority, many people have already had their 2 doses of shots. Okay, and now the government is talking about another booster, a booster shot. What do you think of that?
So that was just approved a few days ago. The goal, as I mentioned just a minute ago, was that it is for allowing the body to produce more antibodies. The approval so far by the government is just for immune compromised patients. They haven't, even though there was a White House briefing, if you remember a few days ago, they recommended a booster for all, but the FDA so far has only immune systems. The drug company, the Pfizer drug company that produces their vaccine, had requested to get approval for their booster, and their data showed that there's an increased antibody production, but unfortunately, the data is just about 1 month or 2 months after that. So this is still being considered, and it's not been FDA approved yet to get a booster for everybody. So currently, the approval is only for patients with bad immune systems, like HIV, chemotherapy patients, for those on high-dose steroids or biologic drugs who have an immune-compromised situation that they will not be able to fight off the COVID virus if they get infected.
What kinds of illnesses what kinds of illnesses are exempted to the vaccine? People with asthma or what? Are they exempted to get the vaccine?
Exemption from the vaccine. The only there's 2 main categories of people that have absolute contraindication to the vaccine. The number one is anaphylactic shock allergy. So if you have a severe allergy and you have anaphylactic shock, that's a contraindication specifically to the vaccine. The other one is if you had a history of blood clots, especially a recent blood clot. If you had like a pulmonary embolism or a DVT, which is a blood in the legs or in the arms, or any recent blood clotting, and that's especially within 6 months, you should not get the vaccine. Those are the two main things that are definite contraindications.
All right. Very good. Okay, doctor. Well, so far, you yourself personally, you have been exposed with what you're doing. You have been exposed to many people who have had COVID. How do you take care of yourself?
Well, that is a constant process we have to deal with. It's so hard. You have to wear your what we call the PPE, or personal protective equipment. And for example, in my worst day when it first started back in March of 2020, one day I saw 53 COVID patients in one afternoon, and I saw each one of them in person. So the recommendation is to wear your PPE, which will be an N95 mask if you're seeing a COVID patient. It's recommended to wear eye protection or a goggle or a face shield. That's recommended, and we're supposed to wear gowns and our gloves. We created the protocols in the hospital when it was first when COVID first came. We had no guidelines anywhere. Everybody was learning about it, and so I was one of the first ones who created the protocol in our hospital system, and working with the health department, and we were able to create these protocols to protect the staff. So we need to have training on how to put them, take them off, not to contaminate yourself, especially touching your face. You have to be careful. Remember the 20-second hand after social distancing. So that's how I protect myself, by following strictly the guidelines for PPE.
And up to now, you have been successful in protecting yourself and your family.
But with God's grace, with God's grace.
Okay, this is really very interesting. I think you're the only, the only Filipino American actually who is a respiratory specialist.
Oh, I'm not a respiratory specialist. I'm just an infectious disease specialist.
Infectious disease specialist. To me, it's the same. Okay. All right, doctor. One last word, your recommendation for people, from our viewers out there, to really take care of themselves for any kinds of variants that are really coming to attack us, which is could be Delta, Lambda, Kappa, whatever, Greek words that are going to throw at us. So what can you recommend?
Well, first of all, I would like to thank Via Times and you for giving me this opportunity, and our Filipino. You're welcome. And the Filipino community is really wonderful here. We help each other. There's a lot of Filipino nurses. There are actually other physicians too, and other healthcare providers, CNAs. You see a lot of Filipinos, and we help each other. Our Philippine consulate to us, and Times and our Filipino restaurants and businesses are all helping each other. And when Governor Pritzker gave me the award 2 weeks ago, he was so congenial, and he was very thankful for us to work. He was the only Filipino representative there. So one of my goals, besides protecting my own staff in my 2 hospitals, is to help advise Filipinos. We need to basically continue to live life. The COVID-19 is not going anywhere. There will be, as you were saying, different variants. There's alpha, beta, delta, and all the Greek alphabets will eventually show up. So what we need to do is to do simple things like hand washing, masking if we're close to other people. We need to do the hand washing. We need to try to boost our immune system. And how do we do that? By having good nutrition. If you could do organic or natural, have enough immune boosting food and vegetables. You need to keep your body healthy. Bad vices. We noticed that smoke, alcoholics are the worst And those diabetics, especially diabetics and obese people who are controlling their diet and their diabetes, do poorly. So vitamins and controlling diabetes and having exercise and vitamins and minerals in your body will help protect you. Some of the good things that anecdotally are recommended are vitamin C, vitamin D, zinc, and all these other minerals and vitamins could help you boost your immune system. Because we've seen a lot of different diseases before, like the flu, and people get infected, people die, but the majority of us recover. But for those with a good immune system, will be able to fight back. So common sense things that we've been recommending before are the things to go. So we need to continue living our life. That's the bottom line, with the precautions, and that's what we should do to be able to protect ourselves.
Well, very, very interesting. And yes, that's a very good advice for us to take care of ourselves and protect ourselves from COVID. But doctor, one last question. Do you think this kind of lifestyle that we're doing right now with the mask and gloves and 6 feet distancing, which is our new normal, will be the kind of lifestyle that we will be living for from now until when?
Well, if you remember back in June, we actually went to phase 5 in Illinois. The restaurants opened, the museums opened, the hotels opened, and even the theater is open. So there's what we call metrics. So if we get enough herd immunity, by either vaccination or being infected previously, we're already immune. And if we get the rates back down again, hopefully less than 3% or 1%, we should be able to live our life normally again. COVID-19 hopefully someday will just become like another flu virus or another cold virus, that it wouldn't, subject us to these draconian restrictions that we have to do or face because of the pandemic right now. So I'm hoping it's not going to be forever. We're currently still in phase 5 in Illinois. The rates have been hovering around 6-7%, but in certain areas it's worse, in other areas it's better. So, and they come in surges or waves. So as more of us get immunity, and as more of us take the necessary precautions and get smarter in dealing with this, we're gonna live life normally. The new normal. Someday, I wish we don't have to wear masks anymore. It was removed recently, but now it's been reinstated because the rates are up again. So eventually, this will go down again, normally again.
Eventually, hopefully, with God's blessing. Well,
So even when it started, they were saying it's probably going to last all the way to the later part of 2021, maybe 2022. So if I were to put a time frame, that's probably what I would say. So we're getting. It's just we were shocked a little bit by the reopening of everything and the new variants that came about. But hopefully it's gonna get better again soon. That's my hope and my prayer.
great, terrific. You've heard it from the expert Filipino American respiratory doctor, that's specialist. All right. Thank you so much. And we would like to invite you later on, one of these days in the future, uh, to update us on COVID-19. Maybe it will be COVID-20 already.
By the way, I would like to thank all the Filipino nurses out there, including my own wife, who's a Filipino nurse also, and everybody who's helping each other and supporting each other and supporting their family members who are frontline workers and essential workers too. Because without us helping each other, we won't be able to go through this pandemic on our own. So this is a good thing that we're helping each other as a community and as family.
Correct. You're right. And we salute you for all your accomplishments, so for what you're doing for the Filipino name and for the community. At maraming salamat po, Dr. Garganera. And, maraming salamat. You're familiar with that. Thank you in our Filipino language. Thank you for gracing our show. At mabuhay po tayong lahat.